When we talk about the ABCs of Medicare, Part D stands for prescription drug plans. And there's a lot that goes into these little plans. Lots of things like when do I enroll and do I even have to enroll into one? So today I'm going to talk to you about the timeline of enrollment as well as what late penalties you might face if you delay that enrollment. So stay tuned. Hi, I'm Jamie Banner, and I'm the founder of Medicare by Jamie. I'm a licensed insurance agent that works specifically with people enrolling into Medicare, and today I'm going to talk to you about Medicare prescription drug plans, and more importantly, when to enroll in these drug plans. Before we get started, if you find the information in this video helpful, I'd appreciate if you give it a thumbs up and subscribe and leave a comment down below. So when we talk about our Medicare prescription drug plans, this is also known as Medicare Part D. And Medicare Part D is very closely associated with Medicare supplement plans, which is what I do. I assist people in finding the best Medicare supplement plan option for them. So if you give me a call, we can talk it through and find the best, most cost-effective supplement plan for you on your original Medicare, as well as talk about your Medicare Part D options. So when we're talking about Medicare prescription drug plans, we need to know the timeline of when we can enroll in these drug plans because we can't kind of just do it whenever we want to. Medicare's got some pretty strict guidelines of when we can get in and out of these plans. The first timeline is going to be your initial enrollment period, and this surrounds your 65th birthday. So it's the same thing with your enrollment with Medicare Part A and Part B. It's going to be around that 7-month window when you enroll into Medicare, which is 3 months before the month of your 65th birthday, the month of your 65th birthday, and 3 months after. So it's that big 7-month window where you can start all your Medicare stuff. You turn 65, you get your red, white, and blue card in the mail, and you're fully into Medicare. And that's when you want to do all these moving pieces. But that's not the case for everybody. Some people continue to work. They stay on their employer group plan or their spouse's employer group plan, and they delay all of their Medicare enrollment. And that would put you into a special enrollment period. So like I said, if you're still working till you're 69 until you're 89, you don't have to enroll in your Medicare right away. You can delay that enrollment. But once you retire, you come off that plan and you get into Medicare, you enter your special enrollment period, and that's when you can start your prescription drug plan. So like I said, when your A and B start, that's when your prescription drug plan will start as well. The other timeline we want to think about is what's called the annual election period. So if we are currently in a prescription drug plan or we just never enrolled in one in the first place and we need to get into one now, like I said, we can't just kind of pick it up whenever we want to. Medicare's got guidelines where they say when we can pick it up and more importantly, when it's going to start. So the annual election period is from October 15th to December 7th every year. And that's when you can initially enroll into a prescription drug plan if you never did, or change your current prescription drug plan for the next year. And although you can enroll into one on October 15th, it's not going to take effect October 16th. It's going to take effect January 1st of the next year. So this is the time period where you kind of set yourself up for the next year. And you can switch into a new drug plan without any underwriting, and a lot of people do that during this annual election period. Maybe your premium's gone up, maybe you've got some new medications that aren't very cost effective on your current drug plan. Like I said, this is the only time that you can do this to change it. So it's very important to be aware of this time period because like I said, you can't just kind of July jump into a new drug plan. You have to wait until this time period. Now, what if you didn't enroll into a prescription drug plan when you turn 65 and now the annual election period's here and you're about 67, 68 and you're like, you know what, I've got some new drugs, I need to get into a prescription drug plan. There's a little bit more that goes into it now. We've got late enrollment penalties. So prescription drug plans are voluntary programs. You do not have to be in a prescription drug plan. It's not a requirement. You can have your Medicare Part A and Part B and never pick up a prescription drug plan if you don't need it. But Medicare kind of strong arms you into getting one because they say, yep, you know what? You don't need it. But if you want one in the future, we're going to charge you. And we're going to charge you a late enrollment penalty. And this is not just a one-time penalty. This is a lifetime penalty that you're going to see added to your monthly premium every month for as long as you stay into the drug plan. And it increases more and more the more you delay it. So if you delay it for 5 months, it's going to be a smaller penalty than if you delayed it for 25 months or 35 months. It's going to increase an increase. And the way they calculate it is a little bit funny, so we're going to kind of get into that now. So the late enrollment penalty is calculated by 1% of the national base beneficiary premium. And now you're thinking, what is that? That's kind of another language to you. So what Medicare does is they take 1% for every month you've delayed, and they times it by this national base beneficiary premium, with is such a mouthful. And what that is they take the premiums for all the drug plans for the year, and they kind of find out what's the average, what's the base one, and they add it to that. So for 2020, that's going to be $32.74. And this can change yearly. It can go up, it can go down. It's going to all be affected on the year you decide to enroll. And I said it's 1% for every month you delayed. So let me give you a little bit of an example. Say we delayed our prescription drug plan enrollment for 13 months, and now we need one. We've got some new meds that are kind of costing us a lot out of pocket. So we decided to delay one, and we've got a 13-month delayed enrollment penalty. So what we do is we take that 13 months and we multiply it by that 1%. So we get 0.13. So that is kind of our percentage. Now we need to take that and multiply it by that national base beneficiary premium, which I said was $32.74, and we end up with $4.26. And just to make it a little bit more complicated, Medicare always rounds to the nearest 10. So we take that $4.26, and that's going to round up to $4.30. And that is our late enrollment penalty. So what happens is this is added to the premium of whatever drug plan we enroll into. So for example, if we enroll into a drug plan that's $13.20 a month, now we need to add this $4.30, and we're looking at about $17.50 a month. So $4.30, not too big of a penalty, you know, it's just kind of a coffee at Starbucks or something like that. It's really if you're delaying for years and years and years, you know, you've delayed it for 20 years and it's time to get in, that could end up being a steep penalty in the future. So it's something to consider. What's going to be more cost effective? Delaying your enrollment or just paying the monthly premium? Because I understand it is hard to pay a $15 monthly premium if you're not taking any prescription drugs. It doesn't really seem logical. Why am I going to pay this money just to pay this money? So it's really important to kind of weigh out what makes more financial sense for you. So I hope this video was pretty helpful on kind of when you need to enroll in your drug plan, and if you don't, kind of what penalty you're going to face. I have another couple of videos. There's one where I'm going to show you exactly how to use the Medicare.gov plan finder so you can compare different drug plans. And I also have a video where I explain to you the stages of coverage involved in prescription drug plans, because there's 4 different stages and it's important to know what goes into each one. Because although prescription drug plans seem kind of small, when you open them up, it's like Pandora's box. There's so much that goes into them, and it's really important to understand everything associated with them. So I hope you found the information in this video helpful. Like I said, I'm going to link those other ones below. If you like this, please give it a thumbs up and subscribe. Leave a comment down below. I also, as always, hit a movie quote in there. So if you can tell me what movie it's from, leave it in the comments. And if you stay tuned, I'm going to give you a tour of my website. It's going to show you how you can request a free Medicare supplement plan quote, as well as how you can access all the free resources I have for you. And those are really beneficial, mostly because they're free and they're going to help really clear up this Medicare journey for you. If you have any questions, you can always call me. My number is 833-65-JAMIE. You can email me at jamie@medicarebyjamie.com, or you can visit my website, medicarebyjamie.com. And thank you for watching. Hi, I'm Jamie Banner, the founder of Medicare by Jamie. I'm going to give you a quick run through of my website so you can easily navigate and find all the important links and information I provided for you. So when we get started, we're going to be right on the home page, and the first thing you can see is you can request a Medicare supplement plan quote. And that's what I do. I assist people in finding the best Medicare supplement plan options for them. So if you go ahead and put your zip code in there and a couple other basic pieces of information, I can get you the best supplement plan quote in your area. Once we get away from there and we go up to the top, we can see the Resource Center. So if we click on the Resource Center, we've got a couple options under there. The first one's going to be Video Library. So when we click there, it's going to take you to a page that shows you all of my YouTube videos. So all my videos will be on there along with their titles, so you can easily kind of search through them and see what video you're looking for based on your current needs. There's also a button up there that says subscribe to YouTube. So that will take you straight to my YouTube channel where you can subscribe, comment, do whatever you need, and find all the videos you need. When we go back to the Resource Center, the next link is going to say Important Links. And that's going to be a ton of different hyperlinks that give a lot of information like finding doctors that take Medicare, maybe filing a claim if you had something, lots of different things that can take you out to show you things you can do for Medicare. And the last section is going to be guides and forms. Now, this one is really important. I've listed a ton of forms that are going to be very important for Medicare. Stuff like employer coverage forms if you're still working past 65, IRMA appeal forms, maybe if you need to check your Part B premium based on your income. I have all of that here, plus a lot of different informative PDFs that's going to give you as much information as you need in Medicare, because that's what we want. We want you to be completely educated on everything Medicare related so you can make the best and most informed decision. I've also got it up here where everything is divided into categories. So if you need to find something a little bit faster, just click one of these categories and it's going to narrow it down to things involved in that section. Again, if you have any questions, you can always call me. My number is 833-65-JAMIE. You can also email me at jamie@medicarebyjamie.com, or you can go to the website and hit the Contact Us button and you can send me a little information. I hope you found this video helpful and thank you for watching.